response to the COVID pandemic, setting up a dedicated field hospital for coronavirus patients and creating an in-house COVID-19 testing laboratory, all done in just 24 hours.
And we cannot isolate COVID-19 patients in our emergency department. So we had to build another emergency room outside the emergency department. And the patients cannot see you. They don't recognize you. You speak to them and they don't know who you are. And it's very difficult. And you have always to say, I'm so-and-so, I am the doctor, this is the nurse, her name is so-and-so. And it was quite a burden working like that. It's very hard, of course, and we don't see the end of it. That must be said. The COVID-19 will remain with us for months, I think, maybe even for years. If we don't find a vaccine, we say we know how much it costs them in their personal life, and we hope that they will cope with it for several months ahead.
Perhaps even more so in the treatment of mental health. How have you and your team been able to tackle that challenge?
This is an important point. Much of mental health treatment is predicated on a connection with the patient, both in terms of being with them physically, but on an emotional and empathic level as well. So social distancing interferes with that. So we're managing, but at the same time, we have to maintain a safe environment for treatment. The other creative approach we're doing to this is to encourage telepsychiatry. So both patients can come into the clinic and the mental health caregiver is either some other part of the clinic or at home, and then they're talking with the telepsychiatry, seeing the therapist, and the therapist also sees the patient very clearly through the video. Or sometimes the patient can be at home, or the therapist can be at home, and then it's done from home to home, home to clinic, so many different approaches. And it works excellently, and patients are very happy with it. And this is something that I think will continue after the COVID-19 crisis. Of these guidelines and restrictions, once the doctors did reach out to the community leaders in the terms of deliberative democracy, discussing, sharing their knowledge and sharing the importance of this, that's when things started to change. So people trusted the doctors. It's not just an emergency room or the treatment room, but it's actually reaching out to the community. First of all, we have to make sure that no harm has been done to patients. And in this situation, making sure no harm is reaching out and sharing our knowledge and explaining what really we're dealing with here. This is the black swan of our generation in terms of medical. Everyone's routine has been changed. This is uncertainty. People don't know what's going to happen. People don't know what's going to happen around them. People's livelihood has been affected. People being thrown off balance by being stuck at home. We see that there are a lot of issues in terms of violence at home, sometimes marital conflicts, and these have long-term consequences. And sometimes what we can help the community both on an individual as well as a social national basis to say, okay, so in life sometimes you don't have control with what happens to us, but we have control with how we deal with what happens to us. People can actually be encouraged to find some kind of meaning in this crisis and come out of this in a stronger way.
The late Dr. Moshe Rothschild always insisted that there was no contradiction between medicine and Halacha. How does this translate into the daily activities at the hospital?
Not only there's no contradiction, the contrary. I think medicine and Halacha complete each other. No rabbi can answer medical questions without a doctor, and no doctor can decide ethical questions without a rabbi. Let's say if somebody comes to me and he asks me, can I fast on Yom Kippur? I'll tell him, I can't decide by myself. I need a doctor I need a doctor for that. If somebody comes to a doctor and says, look, I don't know if to my older father, if to resuscitate him or not to resuscitate him, to make an operation or not to make an operation, it's an ethical question. So he'll, together with the rabbi, who they'll have to decide. It's one you can't do without the other one. I want to tell you something. We feel like a team. We feel like a team, the rabbis and the doctors. We want to one result. The best medical approach for the body and for the soul. Dignity is dignity, love, and sympathy for every patient is part of the halacha way of doing things. But I think even more important is in psychiatric ward. Over there, it's built to the building, the way the patients are treated are special for dignity of these patients. These patients get the best treatment with honor. They don't feel that they're sick or something like that. They feel that they're being honored, and that's therefore I think we have one of the highest rates, healing rates in that ward.
Our patients are safe and they're comfortable, and they love coming to us because they know that they get good professional care and respect for their wishes and for their priorities. Well, our first cases of women who came in to deliver when they were known or diagnosed with the virus were in March. And since March, from March until now, we had over 120 deliveries of women who have the virus. In the beginning of the pandemic, we tried to keep the mothers away from their newborn babies. We would allow them to pump milk and have another loving person care for the baby until the mother recovers, because we were very afraid of that the mothers may transmit the disease to their neonates. So we kept the mothers away from the babies, and it was very traumatic for the mothers and for the babies and for the staff, because this is not natural. And after a few months, we realized that even those mothers who demanded to have their babies and use their masks, their babies did not get sick. And even those who were tested positive were asymptomatic. So we became much more liberal. And now almost all of our patients who do have the disease and come in to deliver, they get their baby to be together with them. And they're rooming in, and the mother takes care of the baby as soon as she's capable of being one-on-one with the baby.
Well, on a day-to-day, we believe in the Family Therapy Center of working together also with the welfare services in the city, and also with the Ministry of Health, with the rehabilitation programs, and with the schools for the children. And the parents themselves have all kinds of programs that help them during the day with the children, like foster daycare, and clubs for the children during the day. And during the coronavirus, all these things stopped. And for parents who have problem functioning on regular basis, suddenly they had to become parents on a full basis. And it was very, very difficult, especially when a lot of these services were shut down and they couldn't receive the extra help that they were receiving usually. So we had to actually prepare a special plan. We had contact with these families at least twice a week with each member of the family. It could be with the parents, it could be with each parent separately, also with the children, and also treating also the family as a whole, but also separately. The psychologists really worked very hard during this Corona time, and I think we really did we made a big difference during this time. And it was also due to all the hard work.
I invite you to support this very unique hospital in any way you can. To learn more about us and to receive our newsletters, please visit our new international website. Thank you all for joining us this evening. Stay safe, and shalom from Mayanei Hayeshua.